But John, real quick, why upper cervical? Why are you an upper cervical doc? Why does it make so much sense to you?
Yeah, I appreciate I think there's two paths. Like you and I represent
Yeah.
the two different paths. Like you had a very personal experience with your own health challenges and like finding your way through upper cervical care to, a better life.
A device called Neckcare. And John, you implement this in your office, right?
Yeah, I've been using Neckcare here for almost 2 years. So just give folks an idea of what the technology is. It's a device that measures a bunch of different functions related to the neck.
Welcome, everyone, to a new episode of the Expect Miracles podcast. Today's episode is sponsored by UCC Near Me. Find an upper cervical chiropractor near you on uccnearme.com. Today, we have such a special guest, one of my closest upper cervical friends out there. He's probably been on the podcast 4 or 5 times now, but it's been a while. And the last time we spoke, a lot has changed in the upper cervical world, so we're going to kind of go over some of those new things that are going on. And without further ado, please welcome Dr. John Stenberg out of Colorado Springs, Colorado at Zenith Chiropractic.
Appreciate you having me back around, Ken. It's fun. Like I was thinking about this before we got on this morning. You and I started on this podcast journey together probably like almost 6 or 8 years ago at this point.
Yeah.
Yeah, there have been a lot of podcasts that have
Yeah.
come and gone, since there. So like I'm proud of us for staying the course, man, because as you know, consistency is the hardest thing with stuff like
sure.
this, but it's opened a lot of interesting doors and just been a really cool experience. So kudos to you for keeping it up. And, for those that have any interest in like throwing their hat in the ring and having a voice in the conversation, like go for it. It's such a fun thing to do and a good networking tool. So I always love having these conversations and
It's
appreciate the
fun
invite.
too because, like, even if the podcast never aired or nobody listened to it, it's such a good conversation. Like, I leave happier after having like a good podcast guest. It's good to catch up and learn new things from different people.
No doubt. And you kind of led with this in the intro, but like one of the cool things about us doing the podcasts early in practice is if folks go back and listen through our catalogs, like you'll hear the
Yeah.
progression of things, like our thinking and our learning and just the different things that have come along in the upper cervical community. So I think that's a really cool thing to leave that like audio library of how things played out over time. And I've changed my mind about stuff. I do things differently than I used to, and like it's all out there. There's no he said, she said kind of like history with that. It's all available, and I like that. I like folks having access to the process and understanding like, hey, we're all sort of working this stuff out and continuing to learn and grow. And over time, obviously, you get better at all this stuff. But I'm excited to talk about some of the things that have been really interesting in the upper cervical world lately because, like we were talking, the way we maybe think about things now compared to when we were fresh in practice are a little different. After you deal with thousands of people, like you have more data points and you think about stuff.
Yeah. And if you guys are looking for a little bit more background on Dr. John, we've done at least 3 or 4 of these. So go back into the catalog. You can get his life story. But John, real quick, why upper cervical? Why are you an upper cervical doc? Why does it make so much sense to you?
Yeah, I appreciate I think there's two paths. Like you and I represent
Yeah.
the two different paths. Like you had a very personal experience with your own health challenges and like finding your way through upper cervical care to, a better life. I kind of came to it from the intellectual angle, meaning like I didn't really have any experience with it as a patient, but in school, you're learning so many things in chiropractic that are like conflicting and confusing. And everybody's got a very strong opinion about what's the right thing to do. But I always gravitated towards things that are efficient and things that are scientific and things that like really seem to help people that other things can't help, And so for me, upper cervical just made so much sense. And I talk about this with patients like literally every day. It's like, man, that part of the spine is just completely different. It's a different set of circumstances there where the head and neck meet. It's super sensitive. It's really mobile. Lots of folks have injuries there. And there's just a laundry list of things that can be related to problems there that just other things aren't going to really help break through with. And so the cool thing about it to me is it's number one, really like the science of it's super compelling. And all the time, the science is like emerging on just how far this goes, And the second part of it is it's really empowering. Like we give folks a chance to say, okay, you know what? Like you're not messed up, like there's some stuff that's not working well, but your body can heal. Like you can get better. And we just need to tune what you've got. Like if we can make things work a little bit better, then you stand to gain your life back, and it's not just lip service. It happens. We see it with people all the time. So for me, like when the science and the real world application meet and then you see it actually play out in people's lives, that's the stuff that really gets me fired up. So, I could have done a million things between now and when I got out into practice, but like I've stuck with upper cervical because it's the real deal.
There's a lot of content on upper cervical now, and there's a lot of people outside the field that don't fully understand it. And I think their one argument against it, they always love to go back to like, oh, BJ Palmer, one bone, and that's all it is. But I think it was static for a long time. And then when we had the CBCTs introduced, you had the 3D X-rays, which were reconfirming everything we were saying. And it's so much more than one bone too. Like the Blair analysis goes down to like you can go all the way down to C7 if you'd like. So it is more than one bone. It's pretty much correcting the structural interference that's going on throughout the neck and other areas of the spine.
Yeah, and I think that's a little bit of a it's unfair, for folks to have. I was talking with my intern about this yesterday, and her parents were surprised at her like wanting to be a chiropractor, and she's explaining to them, upper cervical, and they're like, "That doesn't make any sense. That's not real." And she's like, "Do you know anything about it?" And they're like, "Well, no." Right? So there's a lot of folks that have opinions, but they don't have the knowledge to like form a good opinion. And so I think there's two things to that. Number one is like, yeah, historically, that was the launching point, and like those ideas that BJ Palmer had basically 100 years ago at this point, it's actually kind of insane how on to some things he was. Something he was a little off target, but like that's 100 years ago. The technology has advanced so much that we're able to take that premise and just build on it and refine it and work it out. And you're right, like as technology and science emerge, it's like we're not finding out that it was completely bogus. Like if anything, the science is starting to stack up to support the idea that to take away like the fixation on the bone, for example, like the upper cervical region of the spine, right? Like all the muscles and tissues and structures involved with that. It's not just the bone. Like the atlas isn't some magical bone, but it does have a direct impact on a lot of neurological functions. So if we kind of take a step back and go, all right, it's not about like shoving the bone around in there, but it is about what's the impact of this region of the spine with all of that sensitivity and all that tissue. When you take it to that next level, I think that's where people start to open their eyes to like, okay, this is why maybe all the concussion literature in the last 5 years is saying you should rehabilitate the neck if you want people to have complete resolution of their concussion symptoms. The people that are looking at whiplash and cranial cervical instability and Ehlers-Danlos and all these like conditions that are on the rise, and everybody's zeroing in on the impact that the upper cervical spine has on health and function. It's like, yeah, we're primed to deal with it as long as we like stay in step with where the science is going and our understanding of things, and just kind of like adapt our process to support it.
John, have you ever been presented with the pre and post cerebral spinal fluid studies from Dr. Scott Rosa? I haven't ever. I've heard about them, but no one's ever done like a presentation for me. Can you talk about that a little bit?
Yeah. So Dr. Scott Rosa is an upper cervical chiropractor in New York, and he's been in the game for like 40 years, right? He's been doing this a super long time. He practices a technique called Atlas orthogonal. That was his background in training. And he, through a series of events, got connected with Dr. Damadian, who is one of the sort of like pioneers in MRI technology. And so through his relationship with Dr. Damadian and his, connections there, like they've done a lot of really interesting MRI studies pre and post chiropractic adjustment. And looking again, this is beyond the bones, but looking at some of the physiology of the region, they actually perform upright MRI studies pre and post adjustment and are observing improvements in things like blood flow from the brain through the jugular veins, cerebrospinal fluid circulation through the upper neck, right? So really compelling stuff that looks at like some functions that are really vital to not just how you feel now, but long-term cognitive health and brain performance. And so where his name sort of like really came into the forefront in this field is when he worked on a former NFL legendary quarterback and helped him tremendously after all the concussions and injuries that he'd had. So much so that he got mentioned in a documentary that was on Netflix, with the 1985 Bears team. And so when folks found out that, wait a minute, this chiropractor has been, helping people with brain-related problems, and it has to do with the circulation stuff. And this was all sort of coming about the time you and I were in school and then getting into practice. And so all of a sudden our minds are being blown, looking at like, okay, hold on a second here. It's not just about the muscles and the joints and the nerves. There's a lot going on here that impacts systemic health. And Dr. Flanagan's work, he wrote this book called The Downside of Upright Posture and talks a lot about how the craniospinal hydrodynamics, which is just a fancy way to say like the circulation of the brain and spinal cord is impacted by the structure of the spine. And so that's how Dr. Scott Rosa's name came to, I guess you could say came to fame. And he's one of those guys that literally has folks fly from all over the world to see him for treatment because they're sort of at their wits' end and have found out that, he's the guy. If there's no one else that can do anything for you, you get in touch with Dr. Rosa. And so he has also opened the door to a lot of interesting conversations in upper cervical chiropractic through his connections with folks like Dr. Chris Centeno at the Centeno Schultz Clinic, who's doing stem cell injections in the upper neck and things like that. So he's also been sort of a pioneer in sort of like bringing other folks into this conversation about upper cervical chiropractic, but doing it through some really compelling science and some really compelling patient results, right? So he wasn't beating them up over the head with the story about BJ Palmer, but he was kind of leading with some emerging theories and some breakthroughs in technology. It was like, hold on, this is not what I thought it was. And so you can give Dr. Rosa a lot of credit for, guys like us being inspired to continue to like really push and learn because we see that, over the course of a career, one person can make a huge difference. And it's not only an option, it's sort of our responsibility, to like honor those that have come before us to keep working on it.
And so because of social media and because a lot of people are going and struggling with dizziness issues and vertigo and BPPV and other vestibular issues, people are seeking out upper cervical. Now, I don't want to say it's new, but I would say in the last 5 years, it's really come to light is a device called Neckcare. And John, you implement this in your office, right?
Yeah, I've been using Neckcare here for almost 2 years, and it's kind of an interesting thing because like it's new, meaning they've only been in the US market for a few years, couple of years. But it's not new in that this product started development 20 years ago as a research device. And so the idea is they were looking for ways to quantify neck function. How do we we have good imaging. We know x-rays, MRIs, CAT scans, CBCTs, like the imaging portion of it is pretty well sussed out. But like, how do we get a better handle on how the neck is working in motion, right? Like all the imaging just takes a picture of the spine at rest, but we're not sitting still all the time. We're always moving and grooving. So their research impetus was the thing that brought this product around. And so when they started to, come into the market, like they found out about upper cervical chiropractic through, I think, Dr. Cameron Bearder, who was one of the earliest, customers of theirs and an early adopter in our world. And they're like, wow, these people are like right on par with our interests and objectives. And this is a, fantastic tool for these practitioners. So one of the things about it, it measures things that we've always been measuring, and then it measures some new stuff too. So just give folks an idea of what the technology is. It's a device that measures a bunch of different functions related to the neck. So it's a headset that you wear. It's got a Bluetooth accelerometer, so it's very hands-off in terms of your assessments. So as you have your patient perform, let's say, a range of motion assessment, rather than eyeballing it or fumbling with those stupid goniometers and stuff, like it takes, and it's like, this can't be good data, So it gives you, crystal clear, super precise data about how the spine is moving, how it's compensating, what ranges are available. And it does it all in a way it's super easy to perform, and the patient experiences and sees like how things are going. You can also perform a joint position error test, which is a test of cervical proprioception. If you look into any of the scientific literature about things like cervical proprioception, JPE, joint position error, is like the gold standard test for measuring that. And it's another one of those tests that's always been really clunky to do with a laser on your head where you point at a target and folks reposition their head and try to hit the target. So again, with the software and the wearable headset, it's like super easy to perform and way more accurate for test retest. And then the last thing is called the butterfly test, which I explain to patients is like a test of neck agility. So what they have to do is follow a moving target by moving their head, and it measures how accurately they can follow an unpredictable path of a moving target. So can they match the speed? Can they match the direction? Is there accuracy with that? And like the building on those three, as you go through the course of the assessments, which takes about, 10 or 12 minutes, I always tell folks, like, yeah, we're going to start to accumulate some data and build a case for what's actually going wrong here. And you don't have to take my word for it. Like, you don't have to, you see and experience it for yourself. Like, it's a very experiential exam. And so when folks do it, they're like, I know my neck's jacked up. I felt like that should have been way easier, or I felt like that was such a struggle just to do, something that is like a basic function. So in that way, I found it to be one of the most, next to CBCT, like this has been the most impactful thing for me on clinical decision making, or like figuring out what I'm going to do with that information on the CBCT. And so I found it to be completely valuable. And it also really helps us, like to your point about dizziness, we're dealing with these folks that could have a million things making them dizzy, right? The neck is high on that list, but that's not the only thing. It also helps us, be able to more confidently rule in or rule out, like, is this person going to have a positive experience with upper cervical adjusting? Like, is this actually going to help them? Or is it going to be something where they just never quite break through because some other problem is causing our dizziness? So for me, it really helped create some clarity around some of that.
Staff test determining if it's upper cervical, another issue, or a good combination?
Okay, so because it's such thorough data of the neck, I always tell people this, like, if your neck's moving well and you have pretty decent relocation tests, it's probably not your neck, and that's doesn't mean that the neck's not involved and that the neck is not a problem, but it might not be the main driver of that symptom. And this is, I think, one of the tricky things with like the social media awareness is, even though we don't intend for it to come across this way, I think sometimes what folks hear when they see these conversations about dizziness is that, like, I just get my atlas adjusted and, magically cure my dizziness. And for some people, that's the case. For other people, it's more of a road to recovery. And for other people, it's not going to help them that much. And so we need to know ahead of time, like, which category do you fall into so we can set you up for success. And now upper cervical chiropractic is like not a treatment for anything. Like, it's its own thing, right? Our whole practice methodology is really focused on correcting that upper cervical spine. All of these issues and symptoms people are experiencing are because of the dysfunction. So we're obviously wanting to enhance the dysfunction. But with these types of symptoms, because people are suffering and looking for answers, it does help us, like, tell them definitively, like, hey, you know what, like, your neck is a big part of this, big part of this equation. I told a guy this last night, doing his exam. I'm like, look, man, I can't tell you for sure based on how you feel. I'm fairly certain that it's like a good idea to test this based on your symptoms. But if it presents in this way, and I can do these tests to confirm, like, I'm pretty confident that you're going to really love getting adjusted because it's going to help you feel better. And that's an honest thing to say. And then we go through the test and I'm like, yeah, man, kind of adds up. I think this is going to be good for you. And other times, like, you'll assess people and they feel terrible. And it, like, seems like everything's jacked up. And you go through their assessments and you're like, you know what? Like, the proprioceptive system, like your spatial awareness and movement sense related to the head and neck, which is the problem for cervicogenic dizziness, if that's clear and, like, working well, then we say, okay, so your neck is actually, like, doing okay. I really don't want to screw that up when you're already sensitive. So let's look into something like the vestibular system. Let's look into the eyes. Like, let's make sure that these other things are attended to. So for physical therapy, there's vestibular rehabilitation. Physical therapists are really good at going, to the next level with the vestibular work. There's functional neurology, which are chiropractors trained in basically neuro rehab, brain-based rehab that helps sort of recalibrate some of these dysfunctional systems. And so those are my top two. And very rarely is it just like a hard no, where it's like, you know what, man, like, you don't stand to gain anything here. Go do this first. Those happen on occasion. A lot more of the time, it's a conversation about, like, hey, your neck is a player here. We're going to take a period of time and, like, do a really good job taking care of your neck, see how much you progress. And if there's anything left, we know that the next step looks like PT or functional neurology. And then there's the third category is folks that we say, you know what, like, your neck really needs to be attended to, because if you go get this other treatment, which you need, you're not going to get as much out of it as you would if your neck was dialed in. So all those different pathways are options. And it doesn't put all of the pressure on us to fix everything, but it does give us a way to honestly work with our patients and say, hey, man, like, this stuff with the neck is a really big deal. You're allowed to have more than one problem, and I have referrals for those other problems. So sometimes neuro-optometrists, if you have one of those handy, they do a lot of vision therapy. The vestibular PTs, even some ENT clinics have vestibular rehabilitation as part of their practice, but your experience with ENTs is probably like mine, which is they're usually not doing very much good for these folks. So those are often the referrals. And then even just some basic lifestyle stuff like, getting some, some light aerobic activity, being mindful of things like caffeine and sugar and, blood sugar regulation issues, like little things like that can really help these people a lot. And you know how it is, like if these people see any bit of progress, it just provides so much relief emotionally to know that, okay, I can get better. Like when you're suffering with vertigo and dizziness and stuff like that, it's such a horrible experience day to day that you just want any glimpse of relief, to know that, okay, I'm okay, I can get better. And a lot of times the adjustment is what does that. And then we can fine tune with these other things if we need to.
Exactly. And so, John, I want to talk about, maximizing the holding process with the upper cervical adjustment, because that's when really people start to really feel good is when the adjustment's holding in place. Now, I get a lot of comments on social media, like, what can I do to hold my adjustments? And it's kind of tough if they're not my patient and I'm not like walking them through the daily process. But if you asked me 8 years ago, like, what can I do to hold my adjustment? I would say, listen, I don't want you doing much for the next month or so. I want you just to kind of stay focused. You can go for walks, but don't really do anything much with the neck. And then I got into jujitsu and I was like, this is going to be terrible for my neck, like terrible. And like 3 months in, I'm like, oh my God, my neck is so strong. It's not popping out. Like
Yeah.
it's just constantly engaging those neck muscles. And it completely flipped my perspective on how I manage a lot of my patients now, whereas in the beginning, I'm like, I don't really want you doing much. Obviously, right after the first adjustment, I don't want them doing too much. But as I see them progressing, I'm
Yeah.
like, all right, let's get this neck stronger and start moving it. And so I saw you, you did a really great video on next level, like necks, NECKS level. And it's tell me a
Yeah.
little bit about that because it looks like it's super good at making the neck stronger and possibly holding the adjustments longer.
Yeah, 100%. There's a couple of things with that. Number one would be like, what are we talking about when we say holding the adjustment? And basically, the way I describe that to the patient is like the benefits of the last adjustment are over an extended period of time. Like we don't need to readjust. That's one of the things that drew me to upper cervical. Back to the like start of the conversation was the idea that we can do something with a shelf life. With something that like sustains and gives people the real benefits of chiropractic over time. And I think when I was like learning about chiropractic philosophy, there's so much talk about interference and the idea of like being out of alignment is what causes the problems. But every time I'd go to the chiropractor, I had 5 things out of alignment. I'm like, geez, am I ever okay? And upper cervical was the only thing that said, no, you're actually supposed to not need to be adjusted that much. Like it should stay. And so that was appealing to me. And then how we get there, like you said, is so different for every person. And I think there's a little bit of a misconception about holding, like what's actually going on there. And because, like if someone is holding their first adjustment for a couple weeks, you could take a CBCT, they'll still look out of alignment on their imaging, right? So it's not that the bone is in, but it is that the body has reestablished command and control of that movement. And that means the neuromuscular system is more efficiently moving and operating the neck. And so to your point, okay, if that's really what's going on, how do we enhance that? Because there's plenty of times where folks come in and they don't need to be adjusted. It's like, well, shoot, what can we do to help you now? And you may or may not want to do anything in the office, but this device has filled a really interesting gap in the market, which is like, if you look at even the research and the technology out there for neck strengthening, it's like slim compared to like the low back. There's a million programs for core, for low back, for hips, but when you look at the neck, which is the most important part of the spine, there's hardly anything out there. It's like, how is that possible? So this device was created by Dr. Scott Dickinson. He's a PT. Actually, we did a podcast, Cameron did with him, talking through the development of that. And it's interesting how he figured it out. He started by laying down on a skateboard and turning his head side to side with the wheels turning. So he was looking for that thing that was missing, which is like, man, how do we really isolate out what the neck muscles actually do and apply resistance to them? Because something like jujitsu, you're getting a lot of neck strengthening directly and indirectly. A lot of patients can't tolerate that. They need something that's kind of stepped down to get them up to it. So this device is like a board, and it has a slider on it, super smooth slider. So the patient puts their head on the headrest, and as they turn, the board slides side to side, and it's really controlled, it's really smooth, and it's really high quality materials. Like, it's built real well. And then you can add resistance bands to it. So there's a lot of different options there. You can do active range of motion, like cervical rotation, against the resistance bands, which is actually a lot harder than it looks. The first time I got on it and put the 1 pound resistance band on it and I like felt it.
How
I was
often
like,
are
wow.
you just isolating those muscles by themselves? Yeah.
Exactly. And that's the problem. A lot of folks, like, those deeper muscles are weak and the bigger muscles overwhelm them, and trying to target those deeper muscles triggers the bigger muscles, and it's a whole thing. So this helps break it down, and it's nice because there's various levels of resistance. Honestly, what I like it the most for is isometrics. So isometric exercises are where the muscles are contracting, but you're not moving. And so for some of these folks that might be unstable or they're very sensitive to head neck movements, like, putting extra pressure through those movements can be really uncomfortable, but we can sort of put that board onto the band tension and have the patient hold and resist the movement. And it gives us a really safe way to start introducing some resistance. And, just like anything, when you're strengthening muscles, if you just start going to the gym, like, you make gains pretty quick because your body's adapting to a new stimulus. And so it's actually pretty cool. I don't use it with a ton of patients. I got it for myself to just test it and see how it feels. And I've been playing around with different, creative ways to use that. So I love it in that, like you said, it really targets those very specific muscles and movements that just nothing else really does. The only thing about it that I don't love is it's like, what makes it great is also its limitation, which is it's good at one thing, which is just neck movements. But I have been playing around with, let's say, doing those neck isometrics with some shoulder exercises, bringing some muscles below into it. And that feels awesome. So I think stuff like that is a really nice option for upper cervical docs who are like, you know what, I'm pretty good at adjusting. Like, I'm getting folks holding, but some people are either plateauing, or we need a way to stimulate this muscular system to just get that much more of a robust control here. That's an awesome option because honestly, there's not really an alternative to it. Like, the iron neck is out there, but that's a little bit too high performance, quote unquote, for a lot of our patients. And just finding ways to be able to tolerate, some exercise with the neck is, number one, like, it does facilitate a lot of progress quick because people aren't doing it. And number two, it's empowering. Like, people, when they start to feel that getting stronger, it's like positive feedback. Like, hey, you're actually getting better, and those two things together are really cool. And with the neck, I think of it as like an extension of the core. So if you had a really, deconditioned back muscles, like, you'd be throwing your back out all the time, right? So if you have really deconditioned neck muscles, it's going to be really hard to maintain a change in your structure that we're trying to make. So it makes sense. And I think for anybody who's like even remotely curious, you can go to my Instagram there at zenith_chiro, see some of what Kevin was talking about, me playing around with it in different ways. We'll get an idea of like what it can do. And then there's a link in my bio. I'm one of their like affiliates. If you wanted to get a discount on their product, you can do that through my link. They have a sort of like glide version, which is the portable one. And then they have a clinic, like a pro clinic bundle where you can mount that thing on the wall and you can do it standing and in different positions. So yeah, it's a neat company. I think that they'll probably continue to refine that product. But yeah, like, as far as neck strengthening goes, I mean, I don't really see anything better or a good alternative. So it's well worth, I think they're like $400 or something like that. I think it's well worth the investment to have one in your clinic. Even just for you, man, like, you're bending over patients all day. We all have our own upper cervical problems. Like, we need to take care of our necks too. And I think for docs, like, it's real nice to have one of those even just for yourself and then test it with some patients.
John, one thing I forgot to ask you about Neckcare and the joint positioning error, is that giving you any indication of which level is involved in the neck?
No, not particularly. And that's where the CBCT is really useful. So the range of motion maybe so, but those are more tests of sort of like neck health in general, like how well is the body using the neck. Now, for folks that aren't familiar with joint position error, the way that you perform that test, a patient's sitting up, they close their eyes, they perform a neck movement, like, let's say, a right rotation. So they turn their head to the right, and then they attempt to relocate back to the same position they started in. So we're looking for accuracy in your ability to start and end in that same place. With your eyes closed, you can't visually orient, so you're relying heavily on those sensors and the structures of the neck, like the muscles and the joints, to detect how far you've stretched and to come right back to where you started. Now, when folks have neck injuries and that sense of like spatial awareness is distorted, you'll see all kinds of things. And it's like it looks like a target. It looks like a, like a dartboard. And if you're shooting targets or you're playing darts, like you want to hit the bullseye and you want to be consistent. If you're all over the place, that lack of accuracy shows that, like, okay, you're not very good at this, right? We're moving our head around all the time. If we're not very good at it, it's upsetting to our system. So even though it doesn't tell me necessarily which levels to adjust, I will look at, like, okay, is it flexion and extension? Is it more of a sagittal plane issue? Look at the right and left rotation. Is it more of that plane that's involved? And then maybe correlate that with my imaging. And I think one of the ways you can think about it from a muscular perspective is if someone over or under corrects. So let's say on that example of a right rotation, if I turn to the right and then I come back and I go way over to the left, too far past the center, we know that those left neck muscles pulled you way farther than you should have gone. And so we'll think about, like, okay, and the research on it really is kind of like what brought this up, is the muscles opposite the movement that bring you back to center are the thing that you're testing. So if there's an issue with relocating, you think about what muscles were supposed to bring me back to center. Why did they take me too far or not far enough? And then I might look at the imaging and see, is there compression on that side of the neck? Is there a big stretch on that side of the neck? And where in the spine is that? And does it make sense that if we do adjustments, like, let's choose which side we adjust, considering all the information? Which is one of the cool things about Blair. You can adjust on either side of the neck for any listing that you get. So you can adapt to all this information a lot more readily than maybe some other techniques. So in that way, I think it's great for Blair. And it's cool to see the progress too. Like, people improve on that stuff and they're not faking it. Like, if they perform this test with their eyes closed and they're actually trying, their test retest, like, you'll see improvements, and it's no BS. Like, you don't have to rely on the questionnaire to tell you how you're doing. You can tell them, like, hey, your neck is better. And if you're feeling better, which is 99% of the time, awesome. If you're not feeling better, okay, well, we know that we've done you a lot of good. Like, we know that your neck is getting better. This is a good foundation for whatever else you need to do. Let's have a conversation about that, just so that you're feeling all the way better. So I know it's kind of like a long-winded answer to your question, but I would discourage folks from thinking about tests in that way, but think about it as more of a test of global neck health, and you're trying to zero in on, okay, how functional is this person? How well is their neck working, regardless of how they feel? Some folks with mild symptoms, they're jacked up, man. Like, they're not, and other folks, it's the opposite. So sometimes I'll tell people, like, it feels worse than it is, and, like, that's a good thing, because we can make some subtle improvements and you should feel better. Other people, we say, like, hey, I'm glad we tested this, because, like, I know you're not feeling it yet, but you're kind of on a path to this being a problem. And, having that data keeps you honest about it.
And how quickly do you like to do a reassessment with Neckcare?
Yeah. So I'll do an initial exam, and I'll usually do a second one within 4 to 6 weeks, and then a third one within, 8 to 12 weeks. So I'm testing it at fairly regular intervals. And the way I describe it to patients, it's like, we want to, more than just a one test, like, we want to track trends over time. Right? Like, if you went to the doctor's office and you got your blood pressure checked and it was a little bit high, you wouldn't go crazy with, like, medications and stuff. But if you had a trend that it was just climbing over time, you'd say, all right, something's off the rails here. So it's great to observe the trends. And I think of the range of motion, this is just me personally, as kind of like a leading indicator. Meaning, like, if you're not moving well, you're not going to have good control of that movement, like, so we want to get folks moving better first, make sure they maintain good control of it. And then from there, we can sort of, like, fine tune what we need to do. But I like to have those touch points, within a reasonable amount of time, because once they've got a couple adjustments under their belt, we want to see, like, how's this changing things, and I don't expect for all those tests to, like, always miraculously improve. Like, things are not linear, so having those trends just keeps us on track with, are we at least headed in the right direction? Or how you're feeling in the testing, like, does it make sense, both where we started and where we're going?
All right, John, we are reaching the end here, my friend. And at the end of each podcast, I like to ask all my guests, what is one piece of advice that has really resonated with you through the years that you would like to gift the audience? Could be absolutely anything.
You know what? The first thing that comes to mind is just stay curious. Like, there's so much that you can gain in life if you just don't stop going after things that interest you. And whatever, pulls at your attention, the stuff that, like, just gets stuck in your head and you need to work out, Yeah, you got to go with that. You have to follow that. And for me in this upper cervical world, there has been just an endless, source of rabbit trails of interesting things to explore. And so you got to stay intellectually curious and engaged in those things. And so if you do that, you'll find your way to a meaningful life because you'll spend your time doing things that matter to you. And we were talking before we started recording. There's only so much time in a day, and we all have a lot going on, especially with your work, especially when you're trying to help your fellow man. Stay curious and keep working hard on it because that's the path to being, the type of person that can help people. And that's what we're here for.
And John, where can people find you on social media and websites, all that stuff?
Yeah, at Zenith_Chiro, Zenith. On Instagram is where I interact the most. If you want more on this neck care, Dr. Jonathan Chung, Dr. Cameron Bearder, and I did a 3-part series on YouTube about how to interpret neck care data in upper cervical practice. So there's a playlist on the Atlas of Chiropractic YouTube channel specifically for that. The Atlas of Chiropractic is my podcast. We talk about the science and practice of upper cervical. So we talk about this stuff all the time. There's like 150 episodes there if you want to dig in a little bit more on some of the conditions or some of the research or interviews with experts. That's there too, and it's a really cool resource for folks that are interested in the science of all this. But those would be some really cool resources to follow up on this conversation and dig a little deeper.
Cool. Dr. John, thank you for coming on. Would love to have you back anytime. It's been so good to catch up with you. It's been a while, and it's just good to see you. And thanks for all the info today.
You too, man. I appreciate you and the work you're doing. Keep up the good work.
All right, John.